Hello everyone. Today we have a case of calcific tendonitis in the hip. Now, calcific tendonitis is more common in the shoulder, but you can also get it in the hips. So we have Sharab here who has it in his hip flexor. He sits all day for work, which certainly doesn't help. And basically what it is it's a deposit of hydroxyapatite crystals into the tendon. And it causes stiffness, pain, chronic pain, lack of range of, reduced range of motion, things like that. So again, more common to see it in the shoulder than the hip, but I've been seeing it much more frequently in the hip joint. I'm not sure if that's just because people are sitting more these days, but I've seen an increase in it recently in the last 5 to 7 years. Now, another type of calcific tendonitis in the shoulder, and it's also called adhesive capsulitis, where you can't raise your arm up. Very similar condition. Not exactly the same, but very, very similar. So here's what we do for calcific tendonitis in the hip. We're going to go ahead and use one of these tools. It's ROCKBLADEs. You can also use Graston tools. And you can also get the cheap version online on Amazon. And they're like 30 or 40 bucks. And basically it's called IASTM, Instrument Assisted Soft Tissue Mobilization Tool. And we're just going to do strokes in different directions here just to loosen up the tendon, break up any adhesions, and it's a little bit uncomfortable. You okay? Mm-hmm. And to break up really any of those crystals here that are gathering in the tendon. Now, hydroxyapatite crystals are naturally, we have them in the body naturally. They help with preventing tooth decay, and they help to demineralize or prevent demineralization of the bones. So we produce it naturally, but this has a lot to do with inactivity. So if you're somebody that has calcific tendonitis, you want to do something like this to break up the calcifications. And foam roller is another thing you can do. This Graston tool, use some lotion on the skin before you use it. And it's going to cause some redness if you do this. It's supposed to do that, to cause a little bit of ecchymosis. It brings more blood flow to the area. It's normally supposed to do that. So don't get surprised if you see the hip get red after you do this. And you're going to want to do about 30 strokes on the quad, or if you're doing your shoulder, on the shoulder, and try to mix up the different directions of the strokes. So we're going to go here a little bit different direction. As I said, foam roller, any kind of stretching is helpful. Any soft tissue work you can do to break up those adhesions. Another thing that we've already done here on Sharab is cold laser therapy. Cold laser therapy also breaks up scar tissue and muscle adhesions. So we've done that on him as well. And how are you doing, by the way, with your hip?
Very good.
Okay, great.
Thank you. It's greatly helped.
Yeah, so he originally came into me with a hip problem. We addressed that, and we're still addressing it, even though he's not having so much hip pain. No. But he had a case of sciatica too, some lower back pain with a little sciatica.
Pretty severe.
Yeah. So I shouldn't say a little case, a big case of it. So we're now treating him for that, but we're just showing you folks here how we treat calcific tendonitis. And that's about 30 strokes. You're all set there. If you have any questions or comments, comment below. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.